Childhood vaccinations. For more than 50 years, they have been the shot in the arm recommended almost unanimously by health experts. They say they save lives and prevent the spread of disease. Polio, measles, chickenpox, even the flu, eliminated or decreased because of vaccines.
We almost wiped out this disease, and then it comes back because people don't get vaccinated. And I think that that's the scary part to me, is that it can come back.
But are vaccines themselves dangerous? Some parents say they carry risks. They worry about a possible connection to autism, though none has been proven, and other side effects. They want to make the choice for their children.
Have you guys written a new constitution for us that we're not aware of?
The question is, does their choice affect other children's health and turn back the clock on what many call one of the greatest success stories in public health?
If you're not vaccinated with a medical exemption, you can't come to school. Let's get ahead of it and ensure we really don't have an outbreak.
Tonight, in a special town hall with our partners from the Bangor Daily News, we'll take a closer look at the vaccine debate. Please welcome tonight's guest panelists, Ginger Taylor from the Maine Coalition for Vaccine Choice, and Dr. Merrill Nass from the Ellsworth Free Medical Clinic, pediatrician and public health physician Dr. Dora Mills, Dr. Kevin Flanagan, the medical director of the Office of Maine Care Services, and your moderator, Mark Hyman.
Good evening and welcome to Studio B at WGME 13. I'm Mark Hyman, host of Behind the Headlines. Thank you for joining us. The Centers for Disease Control recommends 28 doses of 10 vaccines to be given to children from birth through age 6. Now, there is no federal law regarding vaccinations, but all 50 states and the District of Columbia do have laws regarding the vaccination of children before they enter public school. Yet, some parents have reservations due to medical, religious, and philosophical objections. It's the vaccination debate tonight. We talk about it. Now, you've already met our panel of experts who are joining us here this evening, but we also have another special guest with us. Our media partner from the Bangor Daily News is Miss Jackie Farwell. She'll be here throughout the evening, and she'll also join in on the discussion. Now, we've got a live audience here who's going to ask a lot of good questions of our panel of experts, but you at home can also join us in this important discussion. WGME 13 Morning News anchor Jana Barnello is manning our social media desk. She'll explain how you can join us. Jana?
Thanks, Mark. Thank you all for being here in our studio audience tonight. And thank you for watching on WGME.com. You will be driving the discussion this evening. If you're on Twitter, use the hashtag #YourVoiceYourFuture. We will be monitoring your comments and questions throughout the next 90 minutes and bringing those comments to our panel. You can also join in at Facebook.com/WGME13. Post anything and everything. We'll get as many of your comments, questions, and concerns to our panel tonight. We look forward to a spirited debate right here in our CBS 13 studios. Mark, back to you.
Thank you, Jana. Now, this is a town hall. It's all about getting questions asked by our public and addressed by our community leaders. But the first question tonight is going to go to our live audience, and it's going to come from me. I'd like our live audience here to respond to the following question with the sound of applause. Your two choices and answers are yes and no. Please respond to this question. Maine state law allows for medical, religious, and/or philosophical exemptions from vaccinations. Do you agree with this law? Those who believe yes, please applaud. Those who believe no, please applaud. It's somewhere close to 50-50. I'm going to put the same question to our panel of experts. Do you agree with the law that allows for exemptions from vaccinations? If you do agree, raise your hand, please. The current exemption?
Yeah.
Okay, so you agree? Those who disagree, raise your hand. So we're sort of 50-50 with our panel as well. If I can get this young lady to join me for a moment, step up here, please. We're going to go right to our, join me over here, please. We're going to go to our live audience for our first question of the evening. Tell us who you are, where do you live, and what is your question?
My name is Linda Morgan Moore. I live here in Portland. I work in the NICU at Maine Medical Center. And as far as the vaccines go, I guess what I don't quite understand, or if you could explain, that in 1964-65, rubella infected 12.5 million Americans, killed 2,000 babies, and caused 20,000 cases of congenital rubella syndrome. whereas in 2006 there were only 11 cases of rubella and 1 case of CRS. How can you justify not vaccinating and exposing pregnant women to CRS and their unborn children?
Let's start with Ms. Taylor.
Well, I don't think there's any doubt that when you have introduced a vaccine into a population, we see the disease decrease. What really is not taken into account in vaccine policy today, which a lot of parents have a problem with, is that the risks from vaccination aren't being taken seriously, and that they're not being properly investigated by doctors. They're not being taken seriously by public health officials. And parents are looking for a true risk-benefit analysis. You know, what is the chance of my child getting this disease, having serious complications from this disease, as opposed to what about adverse outcomes from the vaccine? And at this point, we haven't really wiped out these diseases. And there's a great quote by Martha Herbert, who's a pediatric neurologist at Harvard, who spoke at the main autism conference about this topic. And she said, you know, in America, we haven't really wiped out these diseases. We've really traded them for lifelong chronic illness and disability. And because we've had such increasing levels of autoimmune disorders and neurological problems.
Dr. Flanagan, do you agree with what Ms. Taylor had to say?
I do not. The vaccines, as you just quoted the statistics, have had a profound impact on the diseases and whether they're prevalent, and if they are, to what extent they cause things like death among our infants and children. We as a society don't even know how to contemplate or understand that type of event anymore, when it used to be commonplace. Families used to lose half their children to now vaccine-preventable diseases.
We're back to the live audience. Sir, please tell us who you are, where do you live, and what is your question?
My name is Noah Sherwood. I live in Green, Maine. My question for the panel is this. Given that many people have this idea that vaccines are a social program, that it's just something good for humanity, what many people don't seem to understand is that it's a for-profit industry. Can we get a round number estimate of how many billions of dollars this industry run by corporations is worth? Can we get a number on how much money is behind this?
Dr. Nass, I saw you shaking your
Yes.
head. Do you have some information on this?
I have some. So the Vaccines for Children program was introduced about 20 years ago during the Clinton administration and pays for many vaccines for a large number of children in the United States who are not covered through other insurance programs, so that every child in America basically can get vaccines through a third party. And that program costs the CDC, federal CDC, $4 billion a year. Now, there are 300 vaccines currently in development, and the industry is hoping that vaccines worldwide will become a $100 billion industry in the next couple of decades. I don't know what it is right now for the total U.S.
I do. There was a report that came out at the beginning of the year. What a lot of people don't understand is in 1986 they Congress put into place a liability protection law so that doctors and vaccine makers can't be sued for vaccine injury or death. And they started kind of piling vaccines onto the schedule. It went from a 24-dose schedule to a 70-dose schedule. In that time, just before the law was passed, the vaccine industry made about $750 million a year. Last year, in 2014, it was a $33 billion a year industry, and the report estimates that by 2019, it will be a $57 billion a year industry, because they want to implement an adult vaccine schedule, much like a children's vaccine schedule, that will kind of go along with Obamacare.
I'd like to bring Dr. Mills into the conversation.
Well, I just want to say that even though vaccines cost money, they save many more dollars than they cost. The estimates are that for most vaccines is that you can, for about $1 invested, you save about $10. And for many vaccines, it's even a higher ratio of dollars that you save, because you're saving healthcare costs and deaths as well. From people who are now vaccinated, whereas they used to contract these diseases and even tragically die from them. So vaccines are an extremely cost-effective part of our healthcare system.
You know, we've started off with the last 10 minutes, and we've got some great questions here, but we've had viewers weighing in on this topic for a number of days now. So let's check in with our social media desk. Jana, what do you have for us?
Mark, I'm just now looking through some of these responses, and what is so what's very apparent is that this is clearly a very, very personal issue for each family with children who need to get vaccinated or not. We asked earlier in the evening about did you consider not vaccinating your child, opting out? You know, Maine has about a 5% opt-out rate in 2013. This is a reply from John Hink. He's very well known in the Portland area. He says, I considered it due to mercury in thimerosal. I did some research. I spoke with Sandra Steingraber, who's a scientist, and quickly concluded to vaccinate. That's just one of many stories and a lot of families on the other side of this issue. We want to get to a Facebook question and comment, really, from Sherry. And she says, why hasn't the CDC done a long-term study of vaccinated versus unvaccinated? Former NIH director asked for this in 2008. Nobody will touch it. Why? So, Mark, pose that question to our panel, and let's get this discussion going.
Any thoughts, Dr. Flanagan?
It would be an almost impossible study to do because the standard of care is to administer the vaccine so that we can save lives and we can prevent the long-term complications of things like polio, where people were wheelchair-bound for life, people were placed in iron lungs for life. To then say, well, we're going to take a group, not vaccinate you, and see what happens, you ethically couldn't do that to society or the people.
Dr. Nass?
Yes, but on the other hand, there are many other types of related studies that can be done. So nobody has suggested not vaccinating people who want to be vaccinated, but there are many people who choose not to be vaccinated, and they should be studied to find out what the differences are. Similarly, there are a number of people, children who are well, and then at some point at about 15 or 18 months develop autism. And that group of people has not been studied very carefully to see what the multiple environmental factors could be that led to that change in their neurologic status. So there are certain studies that CDC has avoided doing even when a number of people have recommended it, including the head of NIH, former head.
And the Institute of Medicine actually in 2013 issued a report saying such a study is ethical, it's doable, it would give us good information, that parents wanted it, and that it would be helpful in answering the questions that parents have. They recommended against it because they said it would be too expensive and too time-consuming.